Hello, and welcome to Consumer Times, your trusted guide to consumer awareness and public welfare. Today, we're diving deep into the Ayushman Bharat Card, a lifeline for millions of citizens across India. If you're curious about how this card works, its immense benefits, and the procedure to obtain it, stay with us till the end. Before we further start the issue, please comment, like, share, and do not forget to subscribe and press bell icon to motivate us. The Ayushman Bharat, also known as the Pradhan Mantri Jan Arogya Yojana (PMJAY), is a flagship health insurance scheme launched by the Government of India in 2018. It aims to provide accessible and affordable healthcare to economically weaker sections of society. The Ayushman Bharat Card acts as your entry pass to avail of these healthcare benefits. Key features of the scheme: health coverage, up to 5 lakh rupees per family per year for secondary and tertiary care hospitalization. Coverage scope includes pre-hospitalization, hospitalization, and post-hospitalization expenses. No cap on family size. This ensures that large families are equally benefited. Empaneled hospitals. The scheme covers treatments in both public and private hospitals that are empaneled under PMJAY, cashless and paperless. Beneficiaries can avail of cashless treatment, making the process hassle-free. Benefits of the Ayushman Bharat Card: it brings a plethora of benefits, especially for those who struggle to afford quality healthcare. Let's take a closer look at these advantages. 1. Comprehensive health coverage. The scheme covers the surgery costs, for example cardiac, orthopedic, and neurological surgeries. Medical procedures like chemotherapy and radiotherapy for cancer treatment. Diagnostic tests, consultations, and medicines during hospitalization. Maternity benefits, including normal and cesarean deliveries. 2. Financial security. Medical emergencies often lead to significant financial burdens. With the Ayushman Bharat Card, families are protected against high out-of-pocket expenses for medical treatments. 3. Wide network of hospitals. Beneficiaries can access over 25,000 empaneled hospitals across the country. This includes both government hospitals and private healthcare facilities, ensuring quality treatment is available regardless of location. 4. No discrimination. The scheme does not discriminate based on age, gender, or family size, making it inclusive for all. 5. Focus on preventive healthcare. Ayushman Bharat also promotes preventive healthcare by offering annual health checkups, especially for senior citizens. 6. Ease of access. The card enables cashless and paperless transactions, ensuring that beneficiaries do not face bureaucratic hurdles during medical emergencies. Eligibility criteria for Ayushman Bharat. Not everyone is eligible for the Ayushman Bharat Card. The scheme is designed to assist economically weaker sections of society. Here's how eligibility is determined. Eligibility criteria for Ayushman Bharat. Not everyone is eligible for the Ayushman Bharat Card. The scheme is designed to assist economically weaker sections of society. Here's how eligibility is determined. Rural areas. Families listed under the Socioeconomic Caste Census (SACC) database. And categories include the households with no adult male member aged 16 to 59. Households with no literate adult over 25 years of age, SC/ST households, landless households reliant on manual labor, urban areas, families belonging to specific occupational categories like ragpickers, domestic workers, street vendors, sanitation workers, automatic inclusion. Certain groups such as bonded laborers, homeless individuals, and tribal populations are automatically included. Documents required to apply for the Ayushman Bharat Card. Before applying, ensure you have the following documents ready: Aadhaar card, mandatory for identity verification; ration card, a family identification document, to verify family details; mobile number, for communication and updates; residence proof, such as a utility bill or voter ID; income certificate, to verify economic eligibility. Procedure to obtain the Ayushman Bharat Card. Getting your Ayushman Bharat Card is a simple and straightforward process. Here's a step-by-step guide. 1. Check your eligibility. Visit the official PMJAY website https://pmjay.gov.in. Click on Am I eligible? And enter your mobile number linked with Aadhaar, Verify your eligibility based on SECC data. 2. Locate a Common Service Center, CSC. Head to your nearest CSC or Ayushman Mitra Kendra. These centers are equipped to assist with the application process. 3. Document submission. Submit the required documents mentioned earlier. The operator will verify your details and initiate the card generation process. 4. Get your Ayushman Bharat Card. After successful verification, you'll receive your Ayushman Bharat Card. You can also download a digital copy from the PMAY portal. 5. Use the card for treatment. Present your card at any empaneled hospital to avail of cashless treatment. Common questions about Ayushman Bharat Card. 1. Is there any fee to apply for the Ayushman Bharat Card? No, the application process is free of cost. However, some CSCs may charge a nominal fee for printing the card. 2. Can I apply if I am not listed in the SACC database? Currently, only families listed in the SACC database are eligible. However, you can contact your Gram Panchayat or local body for further assistance. 3. What happens if my name is not included in the PMJAY list? If you are not listed, you cannot avail of the benefits. However, the government periodically updates the database, and you can check your eligibility again. 4. Can one family have multiple Ayushman Bharat cards? No, the card is issued per family unit based on SACC data. Some real-life impact stories are as how the Ayushman Bharat Card has transformed lives. Ramesh's journey. A farmer from Bihar, Ramesh, underwent a heart bypass surgery worth 4 lakh rupees, fully covered under PMJAY. Sita's story. Sita, a homemaker from Uttar Pradesh, received free chemotherapy sessions for breast cancer treatment. Rekha's relief. Rekha's family was able to afford her son's critical kidney surgery in a private hospital, thanks to the Ayushman Bharat Card. These stories highlight the scheme's critical role in saving lives and securing financial stability for families in distress. The Ayushman Bharat Card is more than just a piece of plastic. It is a lifeline for millions of Indians. It ensures that no one has to compromise on healthcare due to financial constraints. If you or someone you know qualifies for this scheme, take action today. Remember, good health is the foundation of a prosperous life. Share this video to spread awareness, and don't forget to like, comment, and subscribe to Consumer Times for more such informative content. Thank you for watching, and see you in the next video. Stay tuned to Consumer Times. And please don't forget to like, share, and subscribe to our channel for updates on critical topics that matter to you.